Hello, good morning, and welcome to this morning's conversation. Please tell us where you're watching us from. We always like to know where you're watching us from, and this is a very, very important topic, so you will do well to either remind someone, tag someone, and as usual, at the end of this conversation, please share this video as widely as you can, because the topic we're about to tackle is very, very important. Okay. Maya Chembe, welcome. Ephraim, good to see you. Ephraim, son of Africa, it's a privilege to have you here. Lenekani, Ruth Nyerinda, all right, good to see you guys. So keep telling us where you're watching us from. Now, the subject of stroke is very, very important, and I'll tell you why it's important. It's important because stroke is a very, very common disease condition. Very common. It's so common that 1 in every 6 people will have a stroke in their lifetime. 1 in every 6 people will have a stroke in their lifetime. So it's that common. And there are certain things about stroke that we need to address. We need to address them because there are things we can do to prevent it, and the causes of stroke are very common in our environment. Some of you walk around with a risk for stroke without even realizing that you are actually carrying a high risk for stroke. And at the end of this conversation, you will see why. And once somebody has a stroke, there are things we need to put in place or to be aware of that makes life a lot easier and better for people, because stroke affects your life in a very, very dramatic way, and it changes your life completely. Now, the question is, what is stroke? Now, stroke is a very weird name for a disease, very strange, because it comes from, the name is derived from being struck, or being struck with a blow. Okay, so if somebody has a stroke, it's as though someone punched them, or someone hammered them, or they got struck. That's where the word stroke comes from. And in terms of a disease process, stroke is a disease of the brain. Basically, you are dealing with somebody who has a brain that has been starved of oxygen. So a portion of the brain has been starved of oxygen. And there are several mechanisms. In fact, there are just 2 major mechanisms how that happens. And each one of those mechanisms has certain features and treatment options that are different one from the other. So a stroke, like I said, can drastically change your life. It can. Now let's go through it. So, one of the things we need to bear in mind about stroke is that everybody needs to act fast. Whether it's relatives, whether it's health workers, the whole system needs to act very fast. Any delay in acting when someone has a stroke just makes the situation very difficult. That's why you find that when people have had stroke, about 1/3 of people die almost immediately after the stroke. Within a few days, 1/3 will die. About 1/3 again will recover from the stroke, and another 1/3 will remain permanently disabled. That's the issue there. And those that make recovery, it is because the relatives acted fast, the hospital acted fast, everybody was acting fast. Now, at the end of this conversation, I hope that we'll make that issue very clear. Now, let's talk about how stroke happens. How does stroke arise? How come people have a stroke. Now, when you're thinking about stroke, I need you to think about it this way, that the brain, in terms of, in relation to the entire body weight, the brain contributes about 2% to your body weight. So if you take your entire body weight and remove 2% of your weight, that is what your brain weighs. Except that, if we take your entire oxygen demand as a human being, more than 20% of your oxygen demand goes to the brain. So you have this tiny, tiny organ which weighs 2% of your body, and it consumes 20% or more of your total oxygen requirements as a human being. Now that's a lot. What does that tell you? It tells you that the brain, for it to function properly, it needs a constant, reliable supply of oxygen. Now, one thing you must also understand about the nature of the brain is that if you deny the brain oxygen, within 5 minutes, it begins to die. It begins to die. And the longer you keep it without oxygen, the damage is usually permanent. So just bear those facts in mind about the brain, is that it demands a lot of oxygen for it to survive. Of course, in addition to other features, the other thing also you need to bear in mind about the brain is that the brain controls a number of functions in your body, if not all of them. Okay? The brain controls speech. There's a specific area in the brain called the Broca's area that controls speech. Just next to the Broca's area, you have another area of the brain that controls your face. And just above that area of the area of the brain that controls your face, you have an area of the brain that controls your hand and your leg. Okay? And then, of course, you have the front part of the brain. It controls your moral standing, your judgment. That's when that area of the brain is affected, the frontal part of the brain is affected, or the front part of the brain is affected. It's very easy for somebody to take off their clothes and walk naked. That's why you'll find that if somebody has a stroke and they are acting confused, it means that the stroke has affected the front part of their brain. Okay? And then there's an area of your brain, mainly on this side, okay, of your brain, it controls memory. So if you see somebody has a stroke and their memory has been affected, you know which area of the brain is affected. And then the back of your head controls your eyes. So if you see somebody who has a stroke, in addition to other features, and they are also complaining of poor vision, you know that, okay, this stroke is in the back of the head. And just below the area of the brain that controls your eyes, below it, you have an area of the brain that controls balance. So you know that if someone has a stroke and they cannot balance properly, you know which area of the brain has been affected. Now, that's a bit too complicated. Let me make it easy. How would you know that someone has a stroke? Even you at home, that this one has a stroke. Now, before we get to the things that you at home can look for in order to know whether someone has had a stroke, let me walk you through the different types of strokes that people can have. Generally speaking, there are two types of stroke. There's what we call ischemic stroke and hemorrhagic stroke. Now, don't worry about the medical terms. We'll make it easy. Ischemic stroke, we are saying that the area of the brain has been affected because the tube that carries blood to that side of the brain has been blocked by something. Something has blocked the blood flow to that area of the brain. We call that ischemic stroke. The other type of stroke, we call it hemorrhagic stroke. Hemorrhagic, basically we are saying bleeding. It means that the tube that carries blood to that side of the brain has burst open and someone is bleeding in the brain. And treatment is different for both ischemic and hemorrhagic stroke. Now, I will describe different treatments as we go. But just bear in mind that there are those two major types of stroke, hemorrhagic and ischemic. And generally speaking, a stroke causes permanent damage. But there are some types of stroke that you can have where you get a stroke, yes, you have all the full-blown features of a stroke, yes, but you make a full recovery within 24 hours. That type of stroke is called a TIA, a transient ischemic attack. Now, with a TIA, which is a transient ischemic attack, the one where you get a full-blown stroke but you recover within 24 hours, that one is just telling you that, sir, madam, in the next one will be very big and permanent. A TIA is a sign. It's just telling you that, madam, next time, the next one will be big and permanent. That's the issue. Now that we've told you that a stroke is basically a disease of your blood vessels, either being blocked or bursting open, and denying an area of the brain blood, or denying an area of the brain oxygen. And depending on which part of the brain is affected, then it will manifest the features based on what function that area of the brain controls. Now, you at home, how would you know that your relative has a stroke? How would you know? And what should you do? And how should you act? What steps do you need to take? I need you to bear this in mind. First of all, you need to act fast. Now, the same word fast is an acronym for the things that you can look for at home and what you must do. The letter F in fast refers to the face. So, you look at their face and ask them to smile or to grin. Ask them to smile. Ask them to do this. Now, if they do that and one side of the face is pulled to one side, then you know that, okay, I'm in the presence of a stroke here. Okay? I'm in the presence of a stroke. And then the next thing you ask them to do is to lift their arms like this. If one arm is failing to be lifted, he or she is having difficulties to lift one arm, they can only lift one, then you know that there's weakness in one of their arms. And that's for the letter A. Then you know that, okay, we are in the presence of a stroke. And then you quickly ask them to repeat any word after you. Tell them, say ball, say car, say orange. If they are failing to say the word out, then you know that their speech is affected. If you have any one of those three, or all of the signs that I've given you, those three signs, their face has moved to one side. Their hands, one arm is weaker than the other. They cannot lift it. And they can't say the words. You are telling them to say the words out and their speech is affected. Once you have those three things affected, the face, the arm, and speech, you have no time. Time becomes a big problem. So the T is time. It means that you have to act fast. Now, in our context, once you have those three signs, and you don't have to wait until all three are present, even if it's just one. And usually you will find that it may be accompanied with a headache. If there's a headache, then you know that they're probably bleeding in the head. That's a stroke. Start running, because time is everything when a patient has a stroke. Time is everything. So once you have a reasonable suspicion as a relative, you've checked the things I've told you about. The face has moved to one side. When they are grinning, the mouth is being put to one side. They can't raise one hand properly. One of the arms is weak. They can't raise it properly together with the other one. And they cannot say words properly. Their speech is slurred. Okay? That's a stroke. Time is everything. Start running. If your insurance policy has access to an ambulance, call an ambulance. Now, I know that ambulance services are almost a luxury in our communities. If you have a car in front of your house, call for help. Call your neighbors to come and help you. Because this person may not be able to walk sometimes. Call your neighbor. Let them help you put this person in the car and drive them to the nearest hospital. And take them to the nearest hospital. When they get to the hospital, professionals will take over and start managing the patient. Now, the treatment of this patient will also depend on how fast they do the CT scan of the brain. Because treatment for ischemic stroke is different from treatment for hemorrhagic stroke. I'll tell you how. If we suspect that someone has an ischemic stroke, then we are saying that this person has a clot that has gone to the head and it is blocking blood flow. And these clots usually come from their blood vessels in your neck, called carotid arteries. They can be blocked with atherosclerotic plaques that come from a lot of having a lot of cholesterol. You can block these arteries that take blood to the head, and there can be plaques that are forming there, and those plaques can dislodge and go into the head and block arteries. Those clots can do that. Or someone may have a heart disease, and the other source for the clots is the heart itself. So if the heart is not beating properly, you know, it's missing beats, usually it tends to form clots within the heart, and the heart can throw clots to the head. These things are very common in patients who have hypertension. People have high BP, very common. Or it's because that the blood vessel has burst open. Now, the best way or the most effective way, of course, if I'm addressing healthcare workers here, when I'm teaching medical students, we usually teach them that these are the clinical features of a hemorrhagic stroke, and these are the clinical features of an ischemic stroke. Despite those features giving you the best guess, they are not foolproof. So the CT scan is foolproof. So meaning that when you reach the hospital must also act fast. They have to do a CT scan very quickly. You have no time. You are trying to save the brain here. Time is everything. So they have to do a CT scan very fast. Now, the CT scan will be able to show the doctors what type of stroke you're dealing with. Are you dealing with a stroke where someone is bleeding in the head, which is hemorrhagic, or are you dealing with an ischemic stroke? Now, if someone is bleeding has a stroke where the blood vessel or the artery has been blocked, they immediately need to be given drugs that dissolve the clot. There are drugs that they need to give immediately to start dissolving the clot. Of course, for patients who have a bleeding disorder, those drugs may not be administered. Okay? Those drugs may not be administered if someone has a bleeding disorder. But they need to give you drugs that dissolve the clot. In the absence of drugs that dissolve the clot, they need to give you a drug that prevents further stroke formation and further clot formation. And this is where they will give you drugs that make blood thin. We use the word making blood thin. It doesn't really make blood thin anyway. We are just using that for the sake of understanding. But they'll give you drugs that prevent platelets from coming together. Like a simple drug like aspirin. They may put the patient on aspirin to prevent further clot formation. Now, aspirin does not dissolve the clot. It simply prevents further clot formation. Now, in advanced societies where they have, technology, some of these machines, you have them here. I'm not sure whether they use them in that regard. They can push a wire all the way to the brain and hook that clot and pull it out. But all that requires people to act fast. Meaning that for you to have very good outcomes with a stroke, you need a community that is well informed about what to do when they are in the presence of a stroke. And then you also need a healthcare service delivery system that is able to respond fast. By that we mean you need a healthcare delivery system that is able to do a CT scan very quickly, and also they are able to give those drugs that are able to dissolve the clot very quickly. Without these facilities, then the best thing your doctors can do is put you on aspirin. But here's the problem. Where a CT scan is not doable and your doctors don't know, if they give you aspirin and the stroke was because of bleeding, the bleeding will never stop. You're just making it worse. Because when somebody is bleeding in the head, the solution sometimes is that they need to do surgery to manage the bleeding. So have you seen? So a stroke where someone is bleeding in the head, they do not need to be given those drugs I talked about, where someone has a clot in the head. Because if you give those to someone who is bleeding in the head, you are making the bleeding worse. Why should you be thinning blood in someone who is bleeding in the head? Why? Why do you want to start thinning the blood in someone who is bleeding? Now here's the problem. A doctor, it's extremely difficult for a doctor to tell just by examining you that this is a type of stroke where someone is bleeding, and this is the type of stroke where someone is just a clot in the head. They can make an educated guess, but it's not foolproof. A lot of these doctors that you see, they are able to make an educated guess, but like I said, it's a guess, it's a gamble. They are right sometimes, but they are not right most of the time. Okay? So it's a gamble. So you cannot leave it to clinical judgment. In as much as after years of experience, okay, any doctor can look at a patient and from the history and from the examination and how the symptoms were evolving, they can actually tell you with a very decent degree of accuracy that this is likely a stroke where someone has bled in the head. Or this one, no, this one is a clot. There's a way in which us as doctors are able to tell because of the information you are giving us and the examination we are looking for. Despite that, we still need to do a CT scan. Unless a doctor is really under extenuating circumstances, there's no CT scan, there's nothing, and the doctor now has to use his clinical judgment to make a decision. And it takes boldness for a doctor to make such decisions, because it's not easy. It's not easy. So you need a CT scan. Okay? You need a CT scan. Sorry, somebody was trying to call me. So you need a CT scan. Now, having said that, now that you know the different types of stroke, from home, you know what to look for and how you must act and what you need to do. What are the possible outcomes of a stroke? In which direction? So your patient now has had a stroke yachitic. What are the possible outcomes? There are 3 possible outcomes after a stroke has happened. The first outcome is that your patient can recover. And if they recover within 24 hours, it's called a transient ischemic attack. Okay? It's called a TIA. It's called a TIA, and a TIA, like I've told you, it's a warning sign that a big one is coming. That's one. The second possible outcome is that your patient may have permanent disability. And the third possible outcome of a stroke is death. Is death. So now, how do you treat a stroke? How do you treat somebody who's had a stroke? Now, for you to successfully treat a patient who's had a stroke, you need to be very aware that a doctor like myself is not enough to treat a patient who has a stroke. You need other professionals. and I'll tell you why. For example, a patient with a stroke may have difficulties swallowing. It's called loss of the gag reflex. When a patient has a stroke, if you touch the back of their mouth, if you, for example, I push a finger at the back of your mouth, you gag, you feel like you want to vomit. Sometimes patients with stroke, that particular sensation gets lost. And when it gets lost, the biggest risk they have is that when they are swallowing, their body is not able to push food in the right direction. So their food may end up in the lungs. And it's extremely dangerous. Okay? When they lose their gag reflex, food can very easily end up, instead of going into the food pipe, it goes into the windpipe. Because the food pipe and the windpipe, they sit right next to each other. And it is that sensation, the gag reflex, which is able to push food in the right direction. And when you lose that gag reflex at the back as a stroke patient, what will kill you is food ending up in the lungs. Imagine you swallow enzema, and enzema goes straight into your lungs instead of going to the food pipe. And to manage that problem, you need the assistance of a nutritionist. That's why to treat a stroke, you don't just need doctors alone. No. Okay? So you need the assistance of a nutritionist who can adjust the diets and just help, with things like that. Sometimes, remember I told you that when you suspect a stroke at home, ask the patient to say something. And if their speech is slurred, then you know that's a stroke. So one of the professionals you will need on hand when you are rehabilitating a patient with a stroke is a speech therapist. Because when speech is affected, you need a speech therapist to help. Remember, we also talked about a patient losing a function in the hand. Sometimes they may even lose function in the leg as well. Here you need the assistance of a physiotherapist and an occupational therapist. Doctors alone cannot manage stroke completely. So you need a physiotherapist and also need an occupational therapist. You may also need to contact the workplace where this person works and see if they can be assigned new types of duties, different types of duties from what they used to do. Reassigning people. The next thing that happens to a patient who has a stroke is because their lives have changed. Either they can no longer talk properly, they can't use their hand properly, they cannot walk properly anymore, they can't even talk properly anymore. What ends up setting in now is mental problems. They start getting anxiety, they start becoming depressed, and it becomes a mental disease. And mental health problems are very common in patients who've suffered a stroke. And this is where now you need the assistance of either a counseling service or a psychiatrist to help you with managing the depression. So that's why the management of a stroke or the treatment of a stroke, if it's you, the doctor who's looking after a patient with a stroke, you also need to be aware of the other disciplines that are needed to come in to assist. A single doctor cannot treat a stroke. You are cheating yourself. So now you need the psychiatrist. You need the, psychologist. You need counseling to help manage the mental aspect. And also the other thing that may help with the mental aspect is where if stroke patients have support groups. Support groups are very important. So you link them to a support group to manage the mental aspect, because sometimes when patients who have the same illness, they're in the same sort of environment, it helps to encourage someone when they can see another person with the same problem who is handling life better. And this is where employers also come in. For employers, if you really want to help your patients who've had a stroke, don't be in a hurry to retire them on health grounds. See if they can be reassigned. Okay? Because, people die quicker when you get them off the things they really, really like to do. See if they can be reassigned within the same job. Find another thing they can do. And also link them to rehab. Don't be in a hurry to retire them on health grounds. The other thing as relatives, and I've seen this a lot of times, when a patient has a stroke and their speech is affected, most relatives mistake it to mean that the brain capacity of the patient or the reasoning capacity or the intelligence is also affected. No, it is not. And that is what brings in depression very easily, because this is a person who is very intelligent, their faculties are still intact, but they just can't talk properly. It can be very frustrating. And the reason it's very frustrating is because they know what they want to tell you, but their mouth is not cooperating. And then you who's listening to them, you also make the mistake of thinking that Muntu is not okay in the head. They are actually okay in the head. They are fine. Their intelligence is intact. It's just a portion of their brain that has been affected, and it is affecting a specific function. So you as relatives, be very careful the way you approach patients with stroke, because depending on how you approach them, you sometimes make things worse, especially their mental side. Because this person is still very intelligent. Very intelligent. The same intelligence they had before the stroke, they still have it after the stroke. Just bear that in mind. It's just the speech which is slurred. All right? Now, I know someone just asked me, doctor, then how do you prevent stroke? Now, the topic of prevention of stroke, I'll combine it with the causes. That way you will not forget. Okay? So the question of prevention, I'll combine it with the question of causes. That way you won't forget. So how do you prevent a stroke? The number one cause of a stroke, not just in Zambia, but globally, is high blood pressure. High blood pressure. Now, with the high blood pressure, we have a problem. A lot of people out there have wrong information on high blood pressure, and there are a lot of people out there who spread wrong information on high blood pressure. I'll tell you some of the wrong information they'll tell you. Some people will tell you, if you have high blood pressure, don't start taking medicines because you will never stop drinking those drugs. And those same drugs will kill you. Be very careful who's telling you that. Because the only way to prevent you from having a stroke if you have high blood pressure is to control that high blood pressure. We must keep it down. The higher you keep working, the more you keep walking around with a high blood pressure, you are a stroke waiting to happen. You are a stroke patient waiting to happen. So be very careful with people who are giving you advice on high blood pressure. No, don't drink the drugs. No, what. Be very careful. Interrogate their intentions. What do they want? Do they want you to have a stroke? Do they want to inherit your husband? Do they want to inherit your wife? Do they want to inherit your property? Ask yourself. No, me, when my BP goes up, I know. Usually people like to say that kind of thing. Me, I usually know it. There's something that I feel when my BP goes up. You feel nothing when your BP goes up. Stop lying to yourself. When your BP goes up, you feel nothing. High blood pressure has no symptoms. Zero. That's why it's called a silent killer. The only time you will discover that you had high blood pressure, you have already got a stroke, or you have a heart attack, or you've gone blind. It's too late at that stage. So to prevent, make sure if you have high blood pressure, your high blood pressure is well controlled. Now, there are people here who walk around with high blood pressure and they don't even know it, that they have it. So another way to prevent that is for you to know. If I asked you right now, what is your blood pressure? Some of you don't know. So go to your clinic, go to any clinic and check for your blood pressure. Just check it. Once you've checked it and you find that it's high, see any doctor near you. If you don't have a doctor near you, come, we will see you ourselves. We can't chase you. See any doctor near you. The second cause of stroke, high cholesterol. Some people walk around with very high cholesterol in their blood. They don't even know that they have high cholesterol in their blood. This is where I applaud and commend a lot of companies that we assist with employee wellness. So we do routine employee checkups. And one of the checkups we check for in the employees is the cholesterol. So when we go into a company, we check the employees for blood pressure and we advise. We also check the employees for cholesterol and we advise. So high cholesterol in your blood, that one makes it puts you at a high risk of forming clots that go to your brain. So if you have a high cholesterol, control it. But again, the type of cholesterol matters. You need to have very high good cholesterol and low bad cholesterol. Maybe one of these days we should talk about cholesterol as a subject. Okay? So, for some of you, you are lucky, especially some of the companies that we have visited as a company, even as myself. But then, if you are lucky that your company pays for your annual checks, we go in and do checks. Sometimes take it upon yourself. These things are not very expensive. Take it upon yourself to check these things once a year. There are times when even here at our clinic, we run promos where we invite you to come for a free check. Maybe we should run one. I'll talk to the team here and see if we can do another one where you come and you do a quick check. Okay? And if you can't, go to any hospital near you. Let them check your cholesterol. Just check it and let them interpret it for you. It's not expensive. Do it once a year. Cholesterol. The other one which causes the stroke is diabetes, which is not controlled. There are some of you here who are walking around with very high blood sugar in your bloodstream and you don't even know it. That too is very easy to check. For some of you, we've checked you through your companies, but make it a habit. Once a year, go to any doctor near you. Go to any facility near you. Let them check these things. Make sure your sugar is fine. Because if your sugar is high and you have high blood and you have diabetes and it's not well controlled, you are at high risk of a stroke. The other one, smoking. So my brother, my sister, if you're watching this and you're smoking, I only have one word for you. Stop. Stop smoking. Just stop. First of all, smoking has no nutritional value. There is no nutritional value that you get out of smoking. There is nothing your body gains from smoking. Nothing. Maybe we can say something about beer, but I don't want to say it. But smoking, man, just stop. Because what smoking does, it just puts you at risk of stroke and nothing else. Your body doesn't gain anything. There's no advantage to the tobacco that you like taking. The next risk factor is alcohol. Here I'm talking about excessive use of alcohol. Beer has some benefits. Okay? And I'm not going to lie to you here. Beer has some benefits for those who know how to drink it. All right? But it has also destroyed many lives for those whom beer is drinking. Instead of you drinking the alcohol, it is the beer now which is drinking you. When the beer is drinking you, my brother, my sister, there is nothing I can do for you. There is nothing anybody can do for you. But for those who drink alcohol or who drink beer or who know how to use alcohol, fine. But excessive alcohol is a very huge risk for stroke. So on alcohol, my advice is reduce and make sure you are drinking the recommended amounts. Have you seen my recommendation on alcohol is a bit different from the one on smoking. And here with smoking, I'm also talking about shisha. Shisha, hey, you look cool and whatever. Yes, you look cool, but do you know how much tobacco you're putting in your system? A person who's smoking a cigarette is far much better than a person who smokes shisha. So when you're in a bar or you're in a nightclub, stay very far away from people who are smoking shisha. Find a corner very far away from those people. In fact, my recommendation is that when a drinking place is serving shisha, put a room, okay, where all people who smoke shisha should go and sit there and smoke it there, away from the rest of us. Stay away from people who smoke shisha. I know you think shisha is innocent. It is not. It's even worse than someone who's smoking cigarettes. Look it up. If you think we are joking here, look it up. So, alcohol. If the alcohol is drinking you, and you are drinking it in excess, you are very likely to suffer a stroke. Very likely. Okay? Very likely. Of course, regular exercise is important. A sedentary lifestyle where you don't do regular exercise, you are putting yourself at risk of a stroke. Where when you go for work, you are in the car, you are seated. You get the office, you do an office job, you are seated. In the evening when you are knocking off, you get back into the car, you are seated. You get home, you are still seated in the couch watching TV. Worse still, you are a smoker. And on top of that, you also take alcohol. And you don't do exercise, you are overweight, and you have high cholesterol. You are a stroke waiting to happen. You're a stroke waiting to happen. So now you've seen, we've combined the prevention and causes so that you're able to remember and not forget. Okay, I think we've talked for too long today. Yeah, almost 50 minutes. Ladies and gentlemen, this has been Dr. Mujajati discussing a very important subject of stroke. What you're going to do for us right now is share this video. Ladies and gentlemen, just click the share button now. Okay, share this video. We need as many people as possible to get this information, because we are losing people to this particular disease. Stroke is extremely, extremely common. There are people who are watching this who already have a stroke or who are nursing someone who has a stroke. It's very common. You'll be surprised. Share this video. Until next time, this has been Dr. Mujajati for healthy and prosperous citizens. Do have a great morning. Good night. Goodbye.